there are two people in the relationship, there are two questions. One is, can you give it to me? And two, did you give it to me? So,
hey guys, welcome to BK Lately. Thank you so much for watching, and everybody who subscribed to my channel. I really appreciate it, and all the love and congratulation messages that I got last week. It was amazing to see that you're also happy that we got to over 100,000 subscribers in about 4 months. So thank you so much. So today's episode is very special to me because I'm a woman. I know that as women, we go through a lot of things, especially physically, with our bodies, with our health. And I just felt like it was very important for me to have this conversation and just help somebody out there who's watching on the other side to get some answers. Maybe not all answers, but maybe a couple of answers. So I brought somebody very special to me. She is my gynecologist. She is the best gynecologist. She's called Dr. Muthoni, and I'm here with her today. And I just want to have a conversation with her about, the basic things about women's health and what it is that we should really take care of when it comes to our health. Women, we have so many issues, and we always have to take care of ourselves. Remember, we are the child bearers. Sometimes we are the single moms. We are the wives, and we are sisters. We are mothers, and we really have to take care of ourselves. So yeah, let me introduce to you, drums roll. So Dr. Muthoni, thank you so much for coming on the show tonight. And first of all, you look really nice.
thank you.
I want to know who's your plug for the dress.
Oh,
You'll tell me, let me fix this for you. We're all about fixing each other's crowns. So, so the last time, I came to your clinic is because I was coming to do a Pap Smear. And I just want you to just explain to us, because I even put it on my YouTube channel, and I was telling people Pap Smears are really important. So thank God mine was normal, thank God. But I just want you to tell us the importance of going through that process.
So the Pap Smear is actually a test to carry out on women. Its purpose is to screen for cervical cancer. The purpose of screening is to detect a condition before it becomes severe. So for cervical cancer, luckily it's one of those conditions you have a long period of abnormality before the abnormality actually becomes cancerous.
Okay.
So when you screen, the purpose is to pick the women who are in the abnormal phase before it actually becomes a cancer. The importance of this is because when it's in the abnormal phase, the treatments are simple and they're curative.
So you actually can get cured?
Yes.
Okay.
And they're very simple. They just include getting rid of the top layer of the cells of the cervix. There are different ways of doing that. When it gets to cancer, it's a whole different ballgame because depending on whether it's early or advanced, it may or may not be curable. So that's what a Pap Smear does.
Okay.
And a Pap Smear is just one of the modalities we have to screen for cervical cancer.
Screen. And who can have a Pap Smear? I mean, because I know there's a vaccine for, is it 6 years?
Actually,
from 6
you
years?
can get it anytime from 9 years.
From 9 years.
Yes.
Okay. So first things first. Who can get who can go through the Pap Smear test, and how often?
All right. So let me answer this question another way. Who can get screened for cervical cancer? Any woman that is sexually active. The reason we use that definition and not the other one for women aged above 21 is because some women start being sexually active very early, even when they're girls. Like if you look at the Kenyan average, it's going lower and lower. Girls as early as 11 years old are getting sexually active, right?
Yeah, I know, it's crazy. 11 years.
Yes.
Yeah,
and
it's
the
crazy.
reason we put it as any woman who's sexually active is because the virus that's associated with causing about 99% of the cervical cancers is human papilloma virus, which is sexually transmitted.
Oh,
right?
okay.
And
All
then
right.
once you get the human papilloma virus, it can cause cancerous changes in 10 to 20 years. So you see, if she starts at 11 and you wait until she's 21 to screen her, or 23, there are quite a number of women who get cancerous changes even earlier than that. In fact, the youngest woman to have cervical cancer was actually in her late teens in this country.
Really?
Yes. So you see, that's why we use the the 3 years after you start sexual contact for you to start getting screened. Yes.
All right.
But generally, any woman above 21 who's sexually active should be screened. If you started sex earlier, then 3 years from the time you had your first sexual contact.
And how often should you go through this the screening?
So when you're doing screening, it depends on your age and the type of screening you're doing. So for women aged below 30, the recommended method of screening is a Pap Smear. And the Pap Smear should be done every 3 to 5 years.
Okay.
Yes. It may be done more frequently if you have certain risk factors, or if your doctor determines your risk is higher than usual. Some of the women who have higher risk are women who have poor immunity, especially the HIV positive women. The screening may be more frequent. If you're aged 30 to 65, the preferred modality is a HPV test, that's a human papillomavirus test. It can be done alone or in combination with a Pap Smear. The best, of course, would be combining the two, what you call a core test. If you do just the Pap Smear, then you need to do it every 3 years.
All right.
If you do it together with the HPV test, the core test, then you can do it every 5 years.
Okay, 5 years.
Yes.
Got it.
And then in low resource settings, there's another modality of testing we use where we use dyes applied on the cervix and see whether it stains normally or abnormally.
How do you do that? Like a dye?
Yes, the dyes we use.
Like dye, like
acetic
DYE.
acid. Yes, a dye. You know, like what you use to. The actually, but the chemical we use is acetic acid. Acetic acid is actually vinegar. You apply it on the cervix. This is the way a normal cervix should appear. If it's abnormal, it stains a bit different.
Oh, really? But don't do it at home.
No. This is done by a health provider.
Don't do it. Don't take vinegar
and
then.
Provider.
Yeah.
It's actually a medical grade vinegar.
Medical, not your apple cider kind of thing.
No.
Yeah.
And then the other dye we use is actually Lugol's iodine. It's similar to like the iodine you normally use, but slightly different.
Okay. All right.
Also, if when you apply to the cervix, an abnormal cervix stains a certain way.
Okay.
So when you do this and it's normal, then you screen every 5 years, and it can be done anytime from the time you're 21 all the way to the time you're 65.
All right.
The time you stop screening is at 65 years of age.
65.
Yes.
That's when you can't get it.
They say if you turn 65 and your previous 2 to 3 tests have been normal, then you can stop. However, if you've had the last few tests have been abnormal, then you need to continue the process until you get a couple of normal tests.
All right. Yes. Thank you for that. So, guys, you've heard. Please, according to the doctor, this is not me. Make sure you get your Pap Smear. Make sure you get screened because it's very important. It's curable, but in the early stages of it being screened, all right, or being known.
Yes. So if you determine it early,
that's the word.
Yes. If you have the precancerous stage, it's easily curable.
It's curable.
So the whole point is to catch it before you get cancer.
Okay.
You had mentioned the vaccine, which is very important to note. We actually give it to young girls. Age between 9 and 13, that's the ideal time, hopefully before they've been exposed. Remember, a vaccine is effective, the effectivity is determined on exposure. So if you get it before you've ever been exposed to the HPV, of course you get maximum benefit. So the best time to give it to the young girls is between 9 and 13
9 and 13 years.
It is available. Even in the government facilities, it is free.
It's free.
Free of charge.
The HPV vaccine is free.
Yes.
Yeah, that's very important.
Then of note, even older women could get it. There's benefits.
When can I get it? I'm a pediatrician miaka.
Oh, well, you shall come, we discuss. Because I was going to say, you talk to your gynecologist and determine risk.
Oh, so I come and talk to you.
The thing is, if you're currently not exposed, it could still be beneficial.
Okay.
But if you get it and you're already exposed, it does nothing about the previous exposure.
Okay.
Yes.
So screening early is very important.
Yes.
All right. So now I want to talk about some of the things that affect us women. Like, I'm sure even these are things that you get patients coming to you so many times about. Yeast infections.
Yes.
UTIs. My goodness, UTIs is just sent from hell. I mean, any woman who's watching and you've gotten a UTI, that thing, it's not a joke. It's not a joke. And a yeast infection. Yes. So I want you, let's start with the yeast infection. So how do you get it and how can you prevent it?
So let's start with the first question, how do you get it?
How do you get a yeast infection?
So yeast is actually normally found in your birth canal.
It is what?
It's normally found in your birth canal.
It is there all the time.
Yes, all the time. It's actually
It's just there
important
chilling.
to have it. It has a physiological role. However, when it overgrows, all right, and the populations are unmanageable, then it manifests as an infection. And this infection is characterized by a discharge. It's usually white or off-white. It's cuddly, like cuddled milk. Yeah. And then it causes quite a bit of itchiness.
Yeah, the irritation.
Yes. So
wow, that thing
the
in a joke.
irritation is what drives women up the road.
That thing is, and especially when it's hot.
Yes.
That thing is not a joke, by the way. I'm sure you guys have gotten yeast infections. If you're a woman, I mean, what is the percentage of women who get it? It's like 100%.
Oh, well, I don't have the data, but quite.
It's so crazy.
And the thing is,
and it's horrible. I hate that thing.
And the interesting thing is that it has nothing to do with sexual activity. You know, you assume it's women who are sexually active who get it.
Yeah.
Even young girls, as soon as you hit puberty, because of the hormonal changes that make you get your periods, you get at risk of getting the yeast infection.
Yeah, so it's not a sexual thing.
No, it's not an STD. So in case you get it, please do not accuse the partner.
Yeah. And do you think there's stigma about women, especially in a relationship, and then you get a yeast infection, and then your dude is just there looking at you like, as in like, where did you get? Is it like, can I get it? Like, can you infect me with a yeast infection?
Actually, it goes both ways. You know, whenever there's a discharge and there are two people in the relationship, there are two questions. One is, can you give it to me? And two, did you give it to me? so the
but I feel
will
like
be wondering, will you infect me?
Will you infect me?
The partner will be wondering, did you give this to me?
Did you give this to me?
So
yeah, we're all blaming each other. Like, did you give me? Yeah.
And that's why we say normally it's unusual for the male partner to pass it on to the female. It is unusual.
So men also get yeast infection.
They may get affected, and that's why when you come and tell us you have a yeast infection, we always ask, is your partner symptomatic? If he's affected, it could be itchy as well. But no, you see, it takes a lot of honesty.
I've always, me in the past, I always told them, yeah,
to say he's also itchy, because there's this whole back and forth accusation process.
Yeah.
Oh, so you're itchy, you gave it to me.
But it's so funny. Because, you know, it has happened to me, like, somebody's like, okay, so did you give it to me?
It is unusual.
It is unusual,
and
guys.
in case they do get it, they'll get a symptom, which is commonly itch.
It's just an itch, guys.
Yes.
All right.
And it's easily treatable.
Okay.
So there are things that trigger a yeast infection. One of them is anything that alters the bacterial, what do you call it, makeup in your birth canal. Yeah? Like if you take antibiotics. In fact, for most women, antibiotics are the commonest cause.
Yeah.
Because when you take antibiotics, not only do they kill the bacteria that's causing an infection, wherever it could be in the throat, the gut, wherever it is, but they also kill your good bacteria in the birth canal. So what happens is that the yeast component overgrows.
Okay.
Right?
So it could be from antibiotics?
Yes, antibiotics can trigger it. The second thing would be some things like what used like contraceptives, especially the oral contraceptive pill, puts women at risk of getting a yeast infection.
Okay.
It can also be from use of antibacterial soaps, especially the Dettol and the rest around the genital area. Also use of heavily scented soaps. It can also be due to hormones, especially the hormonal changes you get just before or after a period. A great number of women get yeast, but just at the point they're having a period.
Yeah.
In addition to that, low immunity, especially diabetes. That's why if you keep on getting yeast infections, most likely the doctor will ask to screen you for diabetes using a sugar test, a blood sugar test. Yeah.
All right. That's so interesting. So it is antibiotics, it is antibacterial soaps that can also cause that. And then there's this thing that women use, the douche, you know.
Yes.
Is that a good thing? Is that a good thing to use? The one that you put inside the love stew is supposed to make you smell like flowers.
We doctors do not recommend use of douches unless it's for medical reason. There are few indications, like 2 or 3, and in that time it will be prescribed for a short duration. After which you stop.
Okay.
Anything else, we advise you to avoid. Your birth canal is self-cleansing. God created it to have an innate mechanism to clean itself. So usually it doesn't need any help.
It doesn't need
And
it.
sometimes when you're trying to help, you may do more harm than good.
Okay.
Because some of those substances you use are a bit harsh. The scents are chemical based. You know, for you to put a scent into a substance, you use chemicals which can irritate. They also, more importantly, alter the pH.
Okay.
The health of your birth canal is based on a pH.
Okay.
Once you alter the pH, then chaos happens.
Got it. Can you get your yeast infections from sitting on a toilet using towels? Maybe you've gone to a hotel and you're using towels. Maybe you sleep naked and you've slept on a bed sheet that is, I don't know. So can you get yeast infections from the your environment?
It could happen. However, it's unusual. Yes.
Oh, it's unusual.
Yes.
So me using a towel that somebody, you shouldn't use towels. You shouldn't share towels. Anyway, you shouldn't share towels. Okay, fine. Even if you go to like a toilet, fine. You wipe.
Yeah.
Some people stand on top of the toilet. I don't know how you guys do that, but
Yeah.
to avoid that, so you cannot get a yeast infection from that.
Not cannot. It could, but it's not the commonest way.
It is not the
getting
commonest way.
Yes, you
Okay.
can always pick infections from public toilets or shared utilities like towels, but it's not the commonest way of getting it.
Okay.
Yeah. And it's generally a good idea to avoid sharing some of these items.
Don't share your stuff.
And also in using public toilets, be really careful.
Be careful, exactly.
Because you may not pick up yeast, but you may pick up other things.
Yes. So let's move on to the UTI, which is the mother of them all. It is the worst thing ever. I don't know who's watching, you've ever gotten a UTI, urinary tract infection. My goodness. First of all, why does it affect more women than men? Because I know men also get it, but not as much as us. As we suffer. And it's like we were just brought in this world to just suffer, Everything for guys is just they pee while standing. So everything's so easy. As you have to squat.
It has nothing to do with being while standing. But it has to do with the way you're created.
Yeah.
When you look at the anatomy of the woman's reproductive system and genitourinary system, the channel that carries urine from the bladder to the outside, that we call the urethra, is short.
For
women.
For women.
Yes.
Okay.
It's longer for men. What's the importance of it being short? It also means that bacteria can easily travel from the outside towards the inside because it's a shorter journey.
Okay.
As opposed to men, where even if it was to travel, it would have a longer route to follow.
It'll die on its way there.
Well, hopefully. So what does that translate to? A higher risk of getting infections. And then the second thing for women of reproductive health is that there's some women who get UTIs following sexual intercourse. We actually call it honeymoon cystitis. It even has a name.
Honeymoon?
Honeymoon. Yes.
Honeymoon cystitis.
Cystitis is just a
Honeymoon
word meaning
cystitis.
a bladder infection.
All right.
And
What does honeymoon means? That you're sexually active.
Okay, initially people are not supposed to have sex until after they're married. And so the initial...
I'm not laughing because I've been married, so I'm allowed.
I'm just saying. So during the honeymoon, of course,
Oh my goodness.
starts taking place.
It starts taking place from after marriage.
Well, you say traditionally.
It is supposed to.
No, traditionally. We are no longer in that
Give me
phase.
sips drink. You guys were having sex before marriage.
So,
Stop it. You see, you guys are in...
no. It has nothing to do with sex before marriage.
Okay.
So now, during sex,
Okay.
of course, there's a friction that's involved. And that friction sometimes can cause inflammation in the outlet of the urethra. Remember, the urethra outlet is just next to the vaginal opening. So that friction can put the woman at risk of getting inflammation. And then, when you have inflammation, it means that the skin or the lining is broken. And when it is broken, it is at higher risk of getting infected.
Yeah.
Right? Yeah. So sometimes sex may play a role.
Yeah.
And for women who get that, we generally would tell them to try and have sex as gentle as can be. We disclaim as can be. And then secondly, to go to the bathroom, empty your bladder before and after.
Okay.
It reduces risk.
So after sexual contact, you go before and after. You pee before and after.
Yes.
So the after, do you hold it or do you just pee? Just like
No, just pee.
just pee.
Yeah.
Okay, so do you get UTIs from like surfaces? The same question I asked about the yeast infection.
Again, commonly no, but sometimes you could. Yes.
Okay, so how can I avoid is it possible to avoid a UTI?
It's not possible to completely avoid it because some of the risk factors are beyond your control, especially like for the pregnant women. If the risk factor is pregnancy, you might not be able to get rid of it.
Okay.
But generally we say if you take lots of fluid, hydrate, the importance of hydrating is cleaning out the system. It's like, just think about it like a jerry can, the one you carry milk in. If you don't clean it out and you put fresh milk, it's likely to go bad. But if you keep cleaning it, then also chances of the milk going bad are lower.
Okay.
It's the same thing with your system.
All right.
If you take water, hydrate, keep passing the urine, and also don't hold it. I know women have a habit of holding it like the whole day because you've not found an appropriate toilet. Or you're waiting to get home to pee. Sometimes it could work against you.
Oh, really? Yes. Holding the pee for too long is bad?
Yes.
Okay.
Yeah.
They just find something, a bush.
And then for women who keep on getting...
Okay, I'm kidding. No, don't hold your pee, but don't look for a bush. This is an unlikely note, guys.
Women who keep getting recurrent infections.
Okay.
There are some probiotics, especially the ones that have cranberry extract, or you can actually take the cranberry juice. It also helps prevent.
Oh, really?
Yes.
All right, that's nice.
The cranberry extracts usually combined with other probiotics that generally decrease the risk of you getting both UTIs and also yeast infections.
And yeast infections.
Yes.
What we forgot to say is, how does UTIs, for people who maybe have never gotten it, or maybe they got it and they didn't know that's a UTI, how does it present itself?
So, for you, a UTI basically means it can be at 3 levels, actually 4 levels. It can just be the urethra that's infected, it can be a bladder infection. For some women, it can go up to the kidneys, which is a more serious form of the infection. So the common things you get are things due to irritation. You feel like passing urine more frequently. When you pass urine, it can be painful. When you pass urine also, you can feel like you've not finished and you keep going back. And then when you go back, you get like 2 drops.
A drop.
And you're wondering.
That thing is the worst thing ever. Like, my gosh.
And also when you feel like going, you feel like you can't hold. We actually call it urgency. You feel like
you have to go now.
Another 1 minute to come.
Kume is a drop that has,
We call it urinary urgency. You can also get lower tummy pain, like almost like cramp-like, especially if it's a bladder infection. For infections that are up going towards the kidney, then you can get hotness of body, that's a fever. You can get nausea, you can get vomiting, and then you can get pain in your flanks.
Okay. Yes. What's flank?
This side.
Oh, here.
Yes.
Okay. All right. So, well, if somebody can't afford you and they have this, yeast infections or UTI, other people advise them use yogurt. Should you just apply it all over? Does that work, by the way?
Usually, it's not a good idea.
It's not a good idea. Yeah. Apparently, it's just to balance that pH.
Yes, but you see, not only do you need to balance the pH, you also need to get rid of the infection. So when you're looking at a yeast infection, there'll be 2 aspects to it. Number 1, cure the infection, and number 2, get rid of the risk factor if you can.
Okay.
So for you to cure the infection, you need to actually treat it, and the treatment comes in form of either vaginal inserts or antifungal tablets, or sometimes a combination of the 2.
Okay.
And the duration can vary from a 1-day treatment all the way to a 6-day treatment, depending on the severity and the choice of drugs used.
All right.
And then if it is recurrent, you may get some, we call it pulse therapy, which is continuing treatment for a couple of weeks or months, where you take a tablet or 2 intermittently. Okay. Yes.
Got it. I see I've given you guys prescription, but no, seek medical advice.
You have to first see the doctor, because what you think might be yeast may
not be yeast. Okay.
Because remember there are other types of vaginal infections. Yes.
Talking about that, I think the last one we'll cover is bacterial vaginosis, which is also, I don't know if it's as common as the 2. I don't know. Is it common, like as common as the other 2?
So
what is it, first of all?
So bacterial vaginosis again is an imbalance.
Why do we have so many problems?
Because a woman is supposed to be balanced, and something goes off balance.
Do men balance anything?
But they don't have anything to balance.
Some can't even balance families. Some can't balance nothing.
Well,
even then, they can't even balance their account balance. Anyway, so yeah, women
it's
again.
A similar concept.
Yeah.
When now, this time it's a bacterial component that goes off balance. Remember with the yeast, it was the yeast component that overgrew.
Yeah.
So when you have bacterial vaginosis, it's a bacterial component that overgrows. So again, it's not a sexually transmitted infection. However, this one occurs in women who are sexually active commonly.
When you're sexually active,
yes, it's unusual,
but it's not sexually transmitted.
No, it's not sexually transmitted. Yeah?
What's the difference? It is sexually.
It occurs in women who are sexually active.
When I'm sexually active.
Yes.
Not that I'm saying I am, but when you are.
If you are, no problem.
I mean, good for me.
Yes, but it's not sexually transmitted. Meaning it's not the male partner that brought it on to you.
Okay.
So it's characterized by, again, a vaginal discharge. This time its character is different. It has a smell. And the color is off. The amount may be varies. It can be a lot, it can be a little.
Yeah.
And one of the things that women complain about is that the smell worsens after sex. Yeah. So when you do get it, then definitely you need to see your doctor to assess. Remember the other causes that can give you a smelly discharge, so they can determine whether it's actually bacterial vaginosis.
Okay.
And the common process, what to expect when you go to the doctor, they'll probably they will examine you, a pelvic exam. It involves use of an object you call a speculum that pushes the vaginal walls apart so that you can inspect the cervix, the outside of the vagina, and look at the discharge. And we'll also take a sample of the discharge and look at it to see if there are any characteristics suggestive of bacterial vaginosis.
Okay.
Yes.
All right.
In case we determine it is bacterial vaginosis, then it is treatable. Again, natural remedies may or may not help because the important thing, number one, is to get rid of the infection, and number two, restore the balance. And for you to do that, you'll get antibiotics, which can be in form of pessaries, those are the inserts, or tablets, or a combination of the two.
Okay. You're such a doctor, or a combination of the two. So, as we wind up, I want you to just maybe in a nutshell just tell us the importance of, women taking care of themselves. Because I think sometimes you have a yeast infection, you're just like, let me just give it a few days. Itaenda. We don't really take ourselves or our health so seriously as we should. So in a nutshell, what can you tell the women who are watching right now, or their husbands, or husbands, or boyfriends, or budescos who are watching and they need to tell this to their women and their girlfriends? Yeah.
So self-care as a woman is very important, whether you're sexually active or not. And self-care starts with hygiene. Of course, you need to keep yourself clean. And also the choice of underwear you use. Of course, we tell you to wear cotton underwear.
What if you don't like underwear?
It is very unpopular because they say all the cotton underwears look like
Mother's Union.
However, you can get
grandma
lace underwear, but make sure the part that comes into contact with your reproductive system down there has a cotton. A cotton interface. The importance of this is to absorb secretions so that you don't stay wet for too long. Okay. Remember, a wet, moist area is a good recipe for bacteria and fungi to multiply. Okay. That's the whole concept.
Okay.
And also cotton is less abrasive.
So what if you don't wear?
Well, it's an interesting concept.
It's an interesting concept.
I don't know what to say about it.
Yeah, I know people who don't like to wear.
Well, but if you find a mechanism to keep yourself clean and dry,
that's all that matters. That's all that matters.
Yeah. And then also there's such a choice of soaps you use.
So let me ask. So these thongs, G-strings, the ones that they go way up, all the way up, or down. Well, are they healthy? Even as you try to impress people.
Well, from a reproductive point of view, no, especially if they don't keep you clean and dry. Yes. But the assumption is you not wear them for too long hours. So maybe even if you need to wear it, it won't be like...
Okay,
So
maybe
that you
just.
give your time to
Okay.
breathe.
So sleep without underwear.
Yes.
Those chicks who sleep with G-strings, CG, what? Why you, like you're killing yourself, girl? Stop it.
So besides hygiene, and then also avoid the douching and those harsh products and perfumes for Donta. Imagine going to create you to smell like a strawberry or whatever else.
And you want to smell like a daisy or a lily. Oh, let's go happy. Oh, let's go happy.
No, besides hygiene, there's also getting yourself.
Wait, are there perfumes for down there?
Yes.
Do you have? Or you're saying let's not use them?
No, don't use
Okay,
them.
we just smell the way we're meant to smell, girls. Okay.
Yeah, and then there's also taking care of yourself. Like if there are any vaccines that you need to take, like the HPV vaccines, you take it.
Yeah.
If you need to do for screening, make sure you do your screening for cervical cancer. And for women above the age of 40, 45 especially, you also need to take care of your breasts, the mammograms.
Yeah.
You need to do that.
Yeah.
And the mammograms are done every 3 to 5 years, depending on risk. Then, in addition to that,
and speaking about that, because it's actually October, the you can do it at home also. I know we've been taught so many times to.
For women below 40, we ask you to do a self-breast examination. If you don't know how to do one, there are nice tutorials on YouTube. There are charts. If you don't, still not confident, come to the gynecologist office. We'll show you how to do it. So basically, we ask you to do this at least once every month or every other month. Check for lumps. In case you get a lump, go to the doctor. It needs to be assessed to see what is causing it and what are the next steps.
Okay.
For women above 40 to 45, then they need to do the mammograms.
The mammograms.
Yes.
Okay.
I know the women are reluctant to do mammograms because of risk of radiation, but that's why they're spaced out. Yes, so don't worry too much about the radiation.
Okay.
All right.
All right.
So that's, and then in case there's something wrong, if there's an unusual discharge, and an unusual discharge can either be unusual in terms of amount, color, or smell. You need to go to the
So
doctor.
discharge, what is a normal discharge? How is it supposed to look?
No, it's not a straightforward answer because it depends on the phase of your cycle.
Okay.
Right? After the period, it's thick, it's creamy, but no smell. At the time of ovulation, it's light and mucousy and stretchable. And then again, towards the next period, it becomes thick, creamy, but again, no smell. So if it becomes a lot that it soaks your underwear and that is unusual, then you see the doctor.
Okay.
If there's a smell, then you need to see the doctor.
Yeah.
If you see a strange color,
Sometimes
you can get green or weird
green.
yellow. Yes.
See a
Or
doctor.
sometimes even bloody.
Oh yeah.
Then you
Okay.
need to see the doctor to determine what is wrong.
All right.
Even the same thing. If you get a UTI, just go see the doctor. And the importance of this is that there are other conditions like pelvic infections that can present with a discharge. And if it goes untreated, it can cause havoc in the reproductive system, like blocked tubes, which can cause problems with fertility in the future. So it needs to get addressed.
All right.
And unfortunately, you just need to see the doctor.
You just need to see Dr. Muthoni.
You might avoid it,
But you have to see the
it's
doctor.
important to see the doctor.
All right. Wow, thank you so much. I mean, gosh, you guys have given you free consultation. But then she's not cheap. Anyway. So, gosh, you guys, like, girls, you've had everything, the most common, not diseases, but what do you call it? Conditions that, we face as women. And I'm sure we've gotten it, you've gotten it, we have all gotten it. So you've heard her. Take care of yourselves, get your vaccine, go see the doctor when you see something that is abnormal. Don't ignore certain things. And and remember to do your breast check. Love them, touch them a little bit. As in to positively. I mean, search for anything that is not normal. Thank you so much, Dr. Muthoni. This has been amazing. Next time what we'll talk about? Contraceptives. For all of those guys who are having sex before their honeymoons and after. So I think the next time we should talk about contraceptives. Yeah. So I hope that you guys have gotten something from this conversation, and I hope that you'll take care of yourselves as women, and I hope that the men who are watching will also take care of their women. I think it's important. Even even when you hear your girlfriend is going to the gyna, ukosifiki wapi, as in we're in this together. If we're in this together at night, let's do this during the day, right? Right?
Agreed.
Agreed. So thank you so much. This has been BK Lately. Actually, it has been a special edition of BK Lately where we inform, educate, and still entertain. So thank you so much. And thank you so much to Two Grapes, a lovely restaurant on George Padmore. It's so beautiful, and they give us their space to shoot in. So thank you so much, Two Grapes. Mwah. And I love this. They call this something refreshing. So yeah, cheers guys. Mwah. Bye-bye. Cheers.